Hello, my name is Young Hong, and I'm an assistant professor of surgery at Cooper University Hospital in Camden, New Jersey. In our most recent resident education committee meeting under the leadership of Dr. Motaz Kodan, we have decided to launch a new SSAT mentorship mentee program. The new program will begin in the coming weeks on the SSAT website, where there will be a link for residents and medical students to submit their request to become a mentee, who will then be paired up with mentors with similar clinical and/or research interests of the mentee. The SSAT mentors will also have an opportunity to provide their clinical and research interests to help facilitate the matching process with mentees who share similar passions and goals. The vision for this new program by the SSAT is to be able to provide a platform to allow mentors and mentees from various universities from all over the country to be paired up to allow growth not limited only to this year, but also to grow this relationship into the future. To demonstrate the benefits of this new program, I have interviewed my mentor here at Cooper University Hospital, Dr. Francis R. Spitz, a renowned surgical oncologist who is the vice chair in the Department of Surgery at Cooper University and who is the deputy director of the MD Anderson Cancer Center here at Cooper.
Well, I think that a surgical career, and especially a career in academic surgery, is a challenge. We face a lot of circumstances where our life experiences may not have been similar to what we're dealing with. It's a work in progress all the way through your career. I can tell you that I still at times seek out the consultation of my colleagues, senior colleagues, and friends concerning what should we be doing. I think when you're first starting out, there's so much that's new, and there's so much that you can gain from the mentor. The mentor has had the experiences. They've lived through those experiences. They've known where they've made mistakes. They've known where things have worked, and that can be very helpful advice for you as you're going through your career. So, I think you have many mentors through your career. There are certain ones that stand out and maybe your primary mentor. When I was a resident, Dr. Frank Rosado was the chairman of the Department of Surgery at Jefferson. And I think, first of all, he was a tremendous example of what we wanted to be, the way he handled things, the way he was as a surgeon, the way he treated patients, the way he treated the other residents was something that you looked up to and you wanted to be. And then as time goes on, you develop a relationship with him. I didn't have a relationship when I was an intern, but by the time you become a senior resident, he was someone that I could count on to ask clinical questions and career questions, including my career choices, and then assisted me in obtaining my fellowship. So there was a process that goes through. There were many others that gave me advice and helped me, but it takes time to develop that relationship with the mentor. I think it starts with someone that you look up to and you appreciate and respect. When I was at MD Anderson, Rafe Pollock was our chairman. There were many quality mentors who have gone on to do amazing things down at MD Anderson, but I developed a relationship with Rafe Pollock, who not only helped me when it came to developing my research career starting at MD Anderson, but also helped me during my academic career, and that has gone on for years. 10, 15 years later, I would call up Dr. Pollock and ask him career advice or questions. So those kind of things stay with you through your career and can be tremendous value. Yeah, well, being an attending is in today's world is a lot of work. It's a lot of stress, and sometimes you feel time constraint. What I have realized over time is that the energy, the satisfaction, the experience that you get mentoring patients is a great help to you in your career. It keeps you going. It gives you joy. It gives you experience. Besides mentoring our residents, that allows us to provide quality and do quality research and research projects. But beyond that, there's tremendous joy and energy that you get out of speaking with your residents and fellows, talking about the career, getting you reinvigorated about your career, refocused on research, and down the line, it's always such a joy to go to the college or go to the annual Society of Surgical Oncology or SSAT and see these people and see that they're doing well. That is a joy. That is just like seeing patients and taking care of patients. Helping these people and mentoring these people and seeing them be successful is a great joy that keeps you going. Well, I imagine there are many types of relationships, but I suspect that they're all based on mutual respect and, from the mentor, a genuine interest in the success of the mentee. I think they all take time to develop, just as relationships take time to develop, some quicker than others. A good and successful relationship will blossom over time. You will continue. You'll work together with a mutual goal of developing that career that your mentor and mentee want for the person who's being mentored.
Great. Thank you, Dr. Spitz, for this amazing interview and for your expert opinion on this topic.
Thank you.